Right, definitely. Just want to remind our audience and our listeners to drop your questions for Ben and Michael. I have a question actually. So there's a token associated with this platform. Can you chat a little bit about the token and explain the purpose there?
Yeah, sure. Ben, you want to talk? You want to explain it?
Yeah, well, actually, like Michael said, it's an ecosystem, right? So we have several services that you can pay for on our platform, and using our token will always discount the price. So this is the first thing. The second thing is that we are working on a platform that is called the social medical platform, where patients can interact with each other and with healthcare professionals, create content. It could be video content, it could be written content, whatever kind of content. Therefore, make the platform itself more valuable, containing a lot of healthcare information. And for this creation of content, they will be incentivized. Mm-hmm. So this is one thing. The other thing is, of course, that we connect hospitals and pharmaceutical companies and patients on a platform that allows to also stream advertisement. And so if there's a company that wants to have advertisement on our platform, they will pay either with fiat money or our token, which also will be massively discounted. So that's the main thing for the token.
Yeah. Mm-hmm. Let's not forget about that are the actual use cases that we have available now. In the next steps, combining it with the NFT marketplace, you will use the token to mint, to buy, to sell the NFTs, the data NFTs, which will also give you a price advantage, which is very important to look at other NFT marketplaces like Rarible, where you can also use the token, etc. And we also give people in the next stage of the company, the token holders, the possibility of governance. So token holders can decide and can give their input and decide about functionalities, about product development inside the social medical network, for example, right? And what also is very important about the token, at the moment it's not, but it will be a DeFi token. Why will it be a DeFi token? The thing is that, let's imagine you have data NFTs as a hospital. Maybe you're a third world hospital and you have a lot of data that you can sell and that you can gather, right? Then you can leverage the data inside the NFT marketplace against the token and against real money. So you have a real value behind it. Because let's speak about the NFTs a little bit. Up to now, it's very difficult / impossible to price tag medical data. Pharmaceutical companies need it, research needs it, hospital needs it, even AI companies will need it, car manufacturers, space agencies, everyone will be in need of medical data. But at the moment, you don't have a possibility to say, what's the value of a data set? Let's talk about the patient that has some chronic diseases, like a heart disease, like high blood pressure, or maybe a cancer disease or some other chronic condition. You are not able to price it. You're not able to handle it comfortably. Ben and I, we both have been also working in the pharmaceutical industry. I myself have been a drug safety officer for some time, and I did some research, and I had to do a lot with medical data and with research data. And it's a big issue because sometimes you get digital forms and you also get paper sheets where the data is written, and it's crossed away, it's deleted. It's really, you don't have, let's imagine you have a medical trial going on. It's really difficult to get good data, and pharmaceutical industry and also other industries spend billions in these data because they need it. But the quality of the data sometimes is really, really bad, and you have to work something out to make it happen, to make the pharmaceutical trial happen, and to find a good way and a reasonable way to have a trustful trial, right? And right. With the NFTs, what we do is we store data inside the NFTs. Will be indexable, which is very important, and it's structured in a certain way, and it's always in the same quality. and it's not changeable. So it's immutable on the blockchain. You know where the data is coming from. It will be anonymized, which is very important. No one inside the platform has to give the data. It's never mandatory. People can always decide to do so. And they can anonymize the data. They can put it into an NFT. They can, a doctor / hospital or a researcher can sign it. So you have a signature of an authority behind it. You put it onto the chain, you sell it. You can follow up where the data is coming from, where it's going to. You know, it's not been altered. It's not been changed. It's not been manipulated. And it's always in the same structure, which is highly valuable. Imagine AI, which will be the future, not only in medicine, but in every type of industry. But AI and machine learning is always depending on high quality data. And if you have paper sheets where everything is crossed away and you have this bad data, you can have a very, very good AI, but the AI can't work because it doesn't have good data. With these NFTs, you will have high quality data, always in the same structure, reliable. You can put it in any trial, AI, or research, whatever you want to do. And it's anonymized, so no one has a disadvantage from that. And combined with smart contracts, everyone gets its part. So there is no, patients don't have to fight for money. Like, and nowadays still it's done in poorer regions of the world. People are being exploited for their data. They are part of trials and still don't know they are part of a trial, which is highly unethical and which is really bad. With this kind of technology, we will pass this, and we will create completely new ways of income streams, income revenues for poorer regions of the world, but also for everyone who wants to take part in this, and everyone is participating. So it's a win-win-win situation for everyone without disclosing the origin of the data, which we think is a big opportunity and a real advantage.
Right, definitely. I mean, there are a number of advantages to a platform like this. And I actually have a follow-up question, but before I ask my question, we have a question from the audience from Factory Data Lab. They're asking, what do you think about Apple and Google? They are focusing also on the healthcare market, and they are close in contact with the end user. They track their fitness and health data.
Yeah, we think this is very important. It opens the door for e-health, because if you're alone on the market, it's always a bad sign, because you say, why am I alone? Maybe it's a bad idea. But Google and Apple, they have big divisions, although there are some setbacks. Just read about that Google Health is shutting down certain services because, everyone is talking about these regulative problems. Everyone is saying, hey guys, GDPR, HIPAA, it's different. Every legislation, every country has its rules, but that's something that will be overcome. That won't be a problem in the future, because the demand for e-health is high. And Apple and Google also have seen that. They've seen that 10 years ago, 20 years ago, maybe even, because the corona crisis now has shown it that the healthcare system as it is absolutely insufficient. A lot of people don't go to hospital at the moment because they're afraid of infecting themselves with corona, and they are staying at home, but they're not in contact with medical services, with doctors. So what do? You have to have services like Aimedis, and like Apple and Google offer, definitely. So yeah, we like it very much, and we see a big advantage that the big players are also in this field and are pushing the development forward.
Right. Yeah. Go ahead, Ben.
Yeah, I think the question is more towards if we see them as a problem for our development, right? As a competitor, we don't see them as a competitor. They are huge, and at a certain stage, they might take over everything. But I think they will look for a company that has set the right infrastructure. Those huge companies, and by the way, we had some discussions with one of these huge companies here with one of the representatives. So we know exactly that they have a focus in healthcare as well. It's slightly different than ours. So we hope, or we maybe let's say it that way. We could imagine that at a certain point, if we continue our journey, that one of these companies would step up and kind of works with us or takes us over, I don't know, something like that. But generally, yes, we see them working on processes. We see them working. I would say some of them have some very interesting developments in terms of hardware. In terms of software, I think that our approach is way more complex in some way, but way more user-friendly, and especially also, focusing on all stakeholders. Like Apple Health, for example, we know everyone has an iPhone, or let's say a lot of people have iPhones, they have their data on it, but have you ever tried to exchange your data with the next hospital? Up to now, it's not working because there's no focus on that, I think, from their side, and maybe the markets are up to now not prepared for Apple or Microsoft or Google, and we tried to find the right approach, and I think we did it. We have implemented some kind of very beneficiary functionalities that not only lead to interest from patients, but from doctors and hospitals and insurers and pharmaceutical companies. So this is something that I think we have that up to now they don't have.
Yeah,
right.
The good thing about Apple, for example, also Google, but especially Apple, is the hardware that they have. That's also something that we focus on, not too strong at the moment, but hardware is a big point. Talking about the Apple Watch, I have it, and I just came out of a COVID disease. I had it. I was in bed 2 weeks, and it was really bad. And I measured at home my blood oxygen level all the time to see if there is an issue or not. So this is really democratizing the way how you can get your medical data. And we also can import this data that I have on the Apple Watch and in Apple Health with our platform and share it with the doctor and combine it with the information maybe you have gotten at a hospital or so. So very good.